I'm Dr. Gabriel Dersam. I'm a pediatric orthopedic here at Women and Children's Hospital in Lafayette, Louisiana. My background is my mother was a special ed school teacher. My dad was a football coach, so I get to practice daily both of their influences on me. I get to take care of kids with special needs. I get to take care of kids who are involved in sports and athletics, and just allows me to carry on some of the things that my parents taught me and be able to help the community that I live in and I serve. I make a strong effort to talk to my patients, understand what they want out of our visits, get a sense for what their expectations are, try to explain to them what we can do to help them, and oftentimes that also means explaining to the patient, often a younger child, in a way that they can understand, but then also be able to pivot and explain to mom and dad what we plan on doing or what we plan on helping the child. And sometimes that's a little different way of explaining it to both, and that's probably one of the skills that you have to get right. So being able to tell a kid how you're going to fix his fracture is a little different than telling how the mom and dad some of the risks and benefits and some of the complications or long-term problems we might run into, and then how we'll might have to deal with those in the future without necessarily scaring the kid. And so sometimes that's a little bit of a fine line. I like it when parents tell me that, well, little Johnny, little Susie were so happy to come back and see Dr. Dersam because they had remembered their first visit or their previous visits in a good light. And that's always a nice thing to hear, that we took care of them and we provided a little happiness in their day.